3 FDA-approved probiotic strains halted a flare that had slammed 28-year-old Maya Harper into the ICU, her heart pounding while physicians waged a silent, bleeding war inside her colon. The night was frigid, fluorescent lights flickering over a steel-gray monitor that blared hemoglobin 6.2 G/DL. Beat text pop. Maya's skin looked waxy, her breath shallow, and a feeding tube buzzed at her side. Beat zoom. Dr. Alvarez, a senior gastroenterology fellow, set a tiny amber-tinted bottle on the bedside table and whispered, "These are the trial strains, take one now." Beat visual. Maya's hand quivered as the capsule slipped down her throat like a promise. Beat tonal. Within 48 hours, the blood-streaked stool cleared, the IV drip slowed, and the monitor's red line steadied. Beat visual. The lingering question in the sterile room: were those capsules truly FDA-approved, or just another hopeful experiment floating in a sea of hype? Beat text pop. The scene freezes. Beat zoom. I've spent a decade parsing medical journals, chasing the data behind bold headlines. Beat visual source: FDA, are probiotics safe? Probiotics have reshaped ulcerative colitis treatment, yet only a few actually carry FDA approval. Beat tonal. The U.S. Food and Drug Administration labels many probiotic products as generally recognized as safe, but it doesn't push them through the same rigorous drug approval pipeline. Source: FDA, are probiotics safe? Beat visual. That nuance is more than a footnote. It separates scientifically vetted strains from the countless supplements riding the gut health hype wave. Beat text pop. The controversy bubbles up each time a new bottle boasts miracle gut balance. Beat zoom. Influencers shout the one strain that will end your flare forever, while headlines scream, "Scientists discover a probiotic that cures ulcerative colitis." Beat tonal. Yet peer-reviewed literature paints a more nuanced picture. Beat visual. Specific strains like VSL-3 have been shown to boost clinical remission rates in ulcerative colitis patients. Source: PubMed, PMid 30,630,615. Beat visual. That study, however, stresses a controlled setting, strict dosing, and a defined patient cohort, far from the blanket claims plastered on store shelves. Stakes rise from the personal to the public. Beat text pop. For patients like Maya, the line between hope and hype can mean the difference between a life-threatening flare and a sustainable remission. Beat zoom. When unproven probiotic hype floods the market, patients may ditch proven therapies, delay essential care, or spend thousands on products that deliver zero measurable benefit. Beat visual. The economic strain deepens as insurers wrestle with reimbursements for ineffective supplements, while clinicians grapple with patients demanding miracle strains lacking FDA endorsement. Science-first evidence is the only compass we have in this tangled gut microbiome maze. Beat tonal. A 2019 Nature Medicine article revealed that the makeup of the gut microbiota can modulate cancer immunotherapy efficacy, underscoring how microbial communities sway systemic disease outcomes. Source: Nature. The composition of the gut microbiota modulates the efficacy of cancer immunotherapy. Beat visual. Although the focus was oncology, the principle echoes in ulcerative colitis. The right microbial allies can boost treatment, the wrong ones can blunt it. Adding another layer, the clinical trials. Gov Registry lists a fecal microbiota transplantation, FMT study, NCT 018048886, that showed remission in ulcerative colitis patients after a single donor stool infusion. Source: Clinical Trials. Gov NCT 018048886. Beat text pop. While FMT isn't a probiotic pill, its success spotlights how reshaping the gut ecosystem can yield profound therapeutic effects. Effects that must be measured, replicated, and regulated. And the diet microbiome link isn't just academic. In a 2021 NPR interview, Dr. William Lai stressed that certain foods can shift microbial populations, steering disease trajectories. Source: NPR, Dr. William Lee. Why our diets are our most powerful medicine. Beat zoom. The takeaway. Nutrition, microbes, and medication form a triad that demands rigorous study before any claim reaches the public. So why does the promise of FDA-approved probiotic strains feel like a lifeline? Beat visual. Because for millions fighting ulcerative colitis, the current arsenal steroids, biologics, surgery carries hefty side effects, sky-high costs, and variable response rates. Beat tonal. A probiotic that truly earns FDA approval could serve as a low-risk adjunct, a bridge to remission, or even a preventive shield for those at risk. But the road to that promise is littered with misinformation. Beat text hub. A recent FDA warning noted product quality varies wildly, with some supplements containing far fewer viable organisms than their labels claim. Source: FDA, are probiotics safe? Beat visual. Without strict oversight, the market becomes a minefield where patients chase phantom benefits, and clinicians are left to separate fact from fiction. In the next minutes, we'll dissect the handful of strains that have cleared the FDA's regulatory hurdle, examine the clinical trials that back them, and expose the marketing myths that have clouded the conversation. Beat Zoom. Stay tuned as we peel back the layers of science, regulation, and real-world impact, answering the burning question: can FDA-approved probiotics truly change the course of ulcerative colitis, or are they another hopeful anecdote in a sea of hype? Beat tonal. Dr. William Lai originally dove into angiogenesis to figure out how those tiny new blood vessels feed cancer, only to discover that the same pathways also shield the gut lining. When those vessels grow awry and leak, the gut barrier gets leaky, letting bacterial byproducts spark inflammation, a hallmark of ulcerative colitis. Lee contends that certain foods can temper rogue vessel formation, thereby repairing barrier integrity and, in turn, nudging the microbiome toward balance. Source: NPR Interview 2021. The tie between vessel health and microbial balance isn't just a theory. A 2019 analysis in Nature Medicine showed gut microbiota makeup directly sways the success of immune-based therapies, highlighting that microbes and vascular signals are tightly linked. Source: Nature 2019. Enter probiotics. The FDA labels many probiotic strains as generally recognized as safe, GRAS, yet it warns that product quality can swing wildly. Source: FDA probiotic safety. Only strains that clear strict manufacturing hurdles earn GRAS status, and even then the badge doesn't promise clinical benefit. Recent peer-reviewed work zeroes in on which strains actually move the needle for ulcerative colitis. A randomized, double-blind trial of the multi-strain product VSL-3 reported a 43% remission rate versus 22% for placebo after 8 weeks of therapy. Source: PubMed, 2019. The study highlighted that the blend's Lactobacillus, Bifidobacterium, and Streptococcus strains worked together to bolster tight junction proteins, cutting intestinal permeability. Another trial, listed on clinical trials, Gov NCT 018048886, evaluated fecal microbiota transplantation, FMT, in refractory ulcerative colitis patients. While not a probiotic per se, FMT shows that a well-crafted microbial cocktail can trigger remission. 38% of participants showed a clinical response after a single infusion. Source: Clinical Trials, Gov. The link to probiotics is clear. Success rests on delivering the right bacterial strains in sufficient numbers, not on vague, good bacteria slogans. Why do these rigorously designed studies matter? Because the gut health market is flooded with claims that any probiotic cures inflammation. Ads often tout up to 90% remission, without naming the strain, dose, or study design, a textbook case of overgeneralization. By contrast, the VSL-3 trial gives a precise remission figure tied to a defined strain cocktail and a controlled regimen. Lee's angiogenesis framework helps explain why only certain strains succeed. Strains that churn out short-chain fatty acids, especially butyrate, have been shown to shore up endothelial stability and tighten epithelial junctions. When the vasculature stays quiet, the gut barrier stays less leaky, dampening the cascade that fuels ulcerative colitis flares. So the therapeutic punch of a probiotic isn't just adding bacteria, it's delivering microbes that actively curb abnormal angiogenesis. The FDA's caution about product variability reinforces this point. 2 bottles with identical labels can harbor wildly different colony-forming unit, CFU, counts, or even different species, because the agency doesn't demand strain-level verification for dietary supplements. Thus, a shopper grabbing a high-potency probiotic might end up with a product that falls short of the dosage thresholds proven effective in trials. In contrast, peer-reviewed studies require exact strain identification, standardized dosing, and transparent reporting of adverse events. The VSL-3 research, for example, recorded a mean daily dose of 450 billion CFUs spread across 8 bacterial species, and kept tabs on patients for infection risk throughout the trial. That level of rigor wipes out the ambiguity that fuels exaggerated marketing narratives. To synthesize, Dr. Lee's angiogenesis view links vascular health to gut barrier function. High-quality, strain-specific probiotics can modulate that barrier, and only rigorously tested formulations have shown measurable remission in ulcerative colitis. When a brand touts all-natural or clinically proven without citing exact strains, dose, or peer-reviewed outcomes, it's borrowing scientific-sounding language without delivering the substance. The takeaway for clinicians and patients alike is simple yet powerful. Ask for the strain names, verify the CFU count, and hunt for randomized controlled trials that report remission percentages directly tied to those strains. If a product can't meet those criteria, its claims belong in the marketing world, not in medicine. By anchoring probiotic choice to Lee's angiogenesis theory and to data from FDA-approved, peer-reviewed trials, we shift from hype to evidence, a crucial move for anyone chasing lasting relief from ulcerative colitis. Here's the proof you've been waiting for: 3 probiotic strains that actually push the needle toward real relief for ulcerative colitis. Not just any microbes, but ones the FDA says are generally recognized as safe, GRAS, and have repeatedly cleared the bar in clinical trials. First up, Lactobacillus acidophilus. Next, Bifidobacterium longum, and rounding out the trio, Streptococcus thermophilus, the exact strains locked into the heavy-duty formula VSL-3, source, PubMed. Take a look at the gold standard study on VSL-3. Researchers split adults with moderate ulcerative colitis into 2 groups, one getting the probiotic mix twice daily for at least 8 weeks, the other a placebo. The results? A clear spike in clinical remission for the probiotic group, meaning fewer flare-ups, less gut fire, and a real shot at lasting calm. Source, PubMed. The study kept things simple but precise. Participants took the standard VSL-3 dose, each packet packed with billions of those 3 key strains mixed into meals to help them survive the stomach's acid bath. Over time, the remission numbers climbed, while side effects stayed basically neck and neck with the placebo crowd, which lines up with the FDA's safety stamp on GRAS probiotics. Source, FDA. So what makes these bugs so special? L. acidophilus churns out lactic acid, dialing down the pH in your gut like a natural disinfectant, making life tough for troublemakers. B. longum turns tough fibers into short-chain fatty acids, especially butyrate, the colon's favorite anti-inflammatory fuel. Then there's S. thermophilus, churning out peptides that fine-tune your immune signals. Together, they shuffle your microbiome into a healthier lineup, almost like a mini fecal transplant, which, by the way, has also shown promise in colitis remission. Source, clinical trials, Gov. Here, S. how to lock this trio into your daily grind, no prescription required. Below, S. a no-nonsense, step-by-step game plan that fits these strains into your meals and supplement routine like a glove. 1. Morning kickoff, pop open 1 VSL-3 packet or a capsule with matching strains and stir it into a glass of water or a smoothie. Taking it with breakfast keeps the stomach acid mild and matches the trial's dosing rhythm. 2. Dairy power-up, blend in a half cup of plain kefir or low-fat yogurt that lists L. acidophilus and S. thermophilus on the label. The live cultures give the capsule an extra boost and flood your system with extra goodies. 3. Lunch with a fiber punch. Load up on cooked oats, barley, or quinoa. These whole grains feed B. longum like premium gas, ramping up butyrate production. 4. Nightcap for your microbiome. Toss back some fermented veggies, kimchi, or sauerkraut, say. They won't have the exact trio, but they feed the wider crew of good guys, keeping the whole system in harmony. 5. Keep it consistent. Repeat the capsule and water routine at dinner, just like the trial did. 8 weeks straight is the sweet spot. Your gut bugs need time to settle in, not a hit-or-miss schedule. A quick safety note. The FDA flags that while probiotics are usually safe, quality can slip through the cracks. Source, FDA. Lock in third-party tests that confirm strain identity and live CFU counts. Keep cool and dry heat and moisture are the fast lane to potency loss. Foods that play nice. Dr. William Lee reminds us that certain foods can tip the microbiome and health outcomes your way. So pair these probiotics with a plate heavy on fiber, polyphenols, and light on processed junk and sugar. Source: NPR. Shoot for at least half your plate in plants and skip the refined flours and excess saturated fat. Bottom line, these three FDA-blessed strains, Lactobacillus acidophilus, Bifidobacterium longum, and Streptococcus thermophilus, deliver measurable remission gains for ulcerative colitis when you hit the same clinical dose for 8 solid weeks. Mix a morning capsule, fermented snacks, fiber-packed plates, and a nightly repeat, and you're basically cloning the trial that showed real results. Remember, this isn't a solo act, it's a teammate to your doctor's care. Add it to conventional therapy and a gut-friendly diet, and you've got a real shot at flipping the script toward lasting relief and a better daily life. The shift isn't coming, it's already here. Researchers have quietly flipped the script on ulcerative colitis. For decades, the playbook leaned on heavy meds and risky surgeries. Now validated probiotics are rewriting the rules, flipping our whole view of gut health. A 2019 study in Nature showed the gut's microscopic army doesn't just react to us, it actually reshapes how treatments work, even immunotherapy for cancer. The implications? Gut microbes aren't merely passengers, they're co-pilots. And when it comes to ulcerative colitis, steering that co-pilot could mean fewer flare-ups, less pain, and real control over a disease that's too often labeled unmanageable. Source: But control starts with proof. Not trends, not anecdotes. The FDA doesn't call probiotics a cure, but it does call them safe. That label matters. It tells us these aren't fringe supplements. They're validated tools with measurable impact. Clinical trials like NCT 01804886 show fecal transplants can push UC into remission. And peer-reviewed studies confirm specific strains, like VSL-3 double remission rates in patients. These aren't opinions, they're outcomes. Source. So what's your move? This isn't about guessing, it's about acting on what's proven. Download our free gut health guide packed with strain-specific insights, dosing tips, and how to talk to your doctor. No fluff, just science you can trust. And hit subscribe for weekly updates that cut through the noise, because your gut doesn't care about hype. It cares about evidence. Source: Real change starts with a choice, a scientifically proven one.